I'm delighted to say Leandra joins me now for her first interview since launching The Watchdog. Leandra, thank you. I mean, I look at those clips and I just feel like it was genuinely barbaric what we did to people in their final years. Luckily, you were able to get your grandmother out so she could spend her final months with her family. But a lot of folk are still stuck in these care homes and the rules remain inhumane, even now.
Yeah, that's right. And I think people, because of our video going viral, people became aware that there were restrictions on visiting, that elderly and young people were being isolated in care homes. People became aware that perhaps there wasn't the right medical care, GPs not going into care homes. But this is still going on today. And this is what I think is totally barbaric. I mean, we had 8-9 months of my nan being in a care home, not being able to see her deterioration. She was dehydrated, she had malnutrition, she lost weight. And yet there are families that are still in that situation who still can't get in to see their loved ones. It just seems like, where's the common sense gone?
And one thing that you point out that I think is really disturbing is the fact that folk now in a lot of care homes have to book appointment times if they're lucky enough to be allowed in. Now, the issue with that is when the care homes are doing dodgy things, and we know a lot of that went on over the pandemic. You have a lot of examples of really appalling, illegal things going on in these care homes. It gives them an opportunity to cover it up because a family member can't just pop in.
Exactly. It's the fact that COVID has shone a light into systems of care that have been failing for decades. They've been understaffed, they've been run for profit. The majority of our care homes are run by private equity firms. And I think people have been really focused on COVID being an issue for people in care homes. But in actual fact, 2 of the 3 co-founders of the People's Care Watchdog, myself and another lady called Fiona, our loved ones nearly died from neglect. It was neglect. In Fiona's case, her mother-in-law had 6 grade 4 pressure ulcers, which means it goes down to bone and tendon. And in the short video that we've created that's on our website, her own son says, you would be prosecuted for treating an animal like that. And yet still to this day, there's no safeguarding, which is something that should be in place to protect our most vulnerable citizens. And yet it's still not there.
But this is the problem with what's happened with COVID, right? And I knew, and this is one of the reasons why I was so opposed to so many of the unnecessary lockdown measures, is COVID is being used as an excuse.
It's being used as an excuse, and COVID is not the only illness out there. It's not the only disease. People suffering from dementia need help. They need care. They need families to be going in and checking up on them, because very often care homes are understaffed. They are run for profit. So what we can see now is that COVID has shone a light on the fact that the families have been propping up those systems. But it's not just about the care homes, it's about the local authorities. It's about the social services, adult social services. Where have they been? Where has the Care Quality Commission been? For 2 years, they didn't inspect care homes. 2 years. And it's incredible. And in that time, all kinds of things have happened behind closed doors, and safeguarding issues are still outstanding.
So what can someone